Injury can have an impact on our body and our mind. And when we can't move in a way that we want to, we can feel powerless. You may have concerns about body image and nutrition post injury, and you might even be trying to regain control by focusing on food. The person most equipped to help you, and we are so delighted to speak with him, is Dr. Ed Tyson. Dr. Tyson is the co founder of the Medical Center for Eating Disorders and has specialized in assessment and treatment of eating disorders for over 30 years. While his primary passion is treating those with eating disorders, he also enjoys teaching about and advocating for those with eating disorders. In this interview with Dr. Tyson, we talk about the most common struggles that you may be facing regarding food and body image and their root causes, and how there's a vicious cycle of food and control that you may find yourself in. We talk about red flags to pay attention to, and we talk about how you know you might benefit from help, and so much more. This is such a wonderful interview, and it was such an honor to speak with Dr. Tyson. We hope you love this interview as much as we enjoyed talking with him.
It's not about fat, food, figure, and fitness. It's about feelings. And that I said all those F words, and so for athletes who are dealing with all that,
Yeah.
easy to focus on the other instead of the feelings, right?
Yeah.
Good.
Yeah,
Sounds good.
exactly. Yeah, so what would you say if you could, because there's a lot within this space of body image, all this stuff, like what would you say are the most common concerns or some common concerns when people come to you or when athletes are getting injured? What would you say would be some common concerns that come up?
The first thing that comes to mind is that they feel powerless to do anything about it. And when I consider athletes to be like, I tell them it's like a thoroughbred who's in a corral, and that is not their natural state.
Mhm.
And it can feel very strange and debilitating in that it takes them into a place they've been away from or never had to be in before. So it can be very strange, threatening, and as well as disturbing, and make them feel powerless because they haven't encountered it before. So the idea of what y'all are doing is to seek people who've been there, done that, who can help them with some of the things that goes on. Whenever anybody is feeling powerless, so they want to grab onto something, and they'll grab onto whatever seems to help at the moment. A very common one is if I'm powerless to do exercise or my sport, or I can no longer be in that sport, I can do other things, but not necessarily the one I really love, that I've done all my life. The common one is to say, well, I've got to do something right now. And most commonly, that would be to restrict or control their eating more. They think, oh, well, at least I can do this. If I'm not, the fear is if I'm not exercising, I'm going to get in such bad shape because I'm debilitated. Now, that may or may not be the case that happens, because there are many things someone can do athletically or physically to maintain a certain level of fitness, but it may not be in the area they desire and are used to. And so it can feel like it's still very foreign.
Mhm.
What I see is people then start to control food. This was a very common thing that happened during the COVID years of isolation, when people couldn't do their sport. They couldn't do martial arts. They couldn't do, you couldn't even go out and run hardly unless you felt miles away from anybody else. Swimming, where could you go swim? You name it. So then people were like, what can I do? I'm afraid I'm going to get out of training and so on. But at least I can change what I eat to where I'm not eating too much. And unfortunately, one of the things that can happen is people restrict and they cut out calories, and they start labeling food, therefore, as some are bad and some are good. Some are healthy and some aren't. And when that happens, people start using food as the central point, and everything else goes around it. And that's when they get into trouble. Because what's lost in that is you're focusing on food and fitness and figure, like I say, but not feelings. And it's easier when well, it's hard to deal with feelings no matter what. Difficult feelings are hard. People don't get trained in it very much. Athletes, quite often, there's what's missing is they train their bodies and all that. They train their mind for fitness and competition, not for what happens when that's not there, or what do you do if something happens. And this is why what you're doing is, I think, a really wise thing for people to ponder, because it's going to happen to anybody who is looking at your website has already been there.
Yeah.
They've already gone through this phase of something's not working, and I don't know how to salvage my life, because quite often it is their life. It may be their profession and their career that they've lost. I've seen, for example, ballerinas who are professional ballerinas getting paid to do ballet. And then if they, hurt let's say they get a stress fracture and they can't leap and they can't jump and they can't do anything on their feet, then it's like their career is over. And then they really feel lost. And that can happen in any professional sport.
Yeah.
But other people aspiring to that, or people who get so much pleasure out of doing so much exercise, which is, for those who do it, they get this. They don't need to be told what it's like. So then when people look at food and then it gets translated into fitness and what's the bad food, what's the good, fat is a 4-letter word, kind of thing. And then that becomes more and more the central part. More and more they focus on it, the more and more they feel out of control is the problem. Therefore, they ramp it up even more, or then they get confused because somebody who starts restricting, then they have lower their energy, they lower their protein, maybe their carbohydrates for their muscles, or fat to burn for the energy, or a combination of those. Then they get more deconditioned, and when that happens, they've got to ramp it up even more because they can't do the exercise, or they try to do everything, and it can spiral and spiral down. And it becomes,
we talk about a lot of cycles in this class,
yes,
different cycles that people get themselves into, and this is another one.
yeah,
Yeah.
absolutely can be a spiral down very quickly. It can happen fast too.
Yeah, one thing that Heidi was saying is that after surgery, or it is this interesting time for athletes, because a lot of athletes, we can acknowledge, are already have disordered eating or challenges with it, right?
Yeah.
And then you add the injury, and it's a whole other layer to it. But when your body is injured, you still need fuel, especially after surgery, or like your brain needs so much fuel in different kinds. And so I don't know, do you have any recommendations for that, or any thoughts around that, of the athletes are thinking, I'm injured, I can't exercise in the same way, so I got to restrict. On that flip side of you're injured, your body needs more fuel or different kinds, or I don't know, something, any thoughts around that?
Yeah. For one thing, when somebody starts restricting, how do they know that they're doing too little or too much? And then the only thing they tend to use is weight.
Yeah.
And I want to caution people out there, weight is only a measure of gravitational force. It does not tell you anything about what the weight is made of, whether it's good or bad or whatever. Somebody gets dehydrated, wow, their weight's down. But if they've been restricting, they think that's good, and so on. And so it's a simple thing, and a lot of people focus on it, and that can be a trap. Another one is, as one restricts, some phenomena happen inside the brain, one of which is the area of visual spatial relationships changes and does not seem to get the same amount of blood flow. So that part of your brain that looks at yourself and sees your thighs, your arms, or whatever, your body, is not working the way it used to. But you still see what you see. And I tell people all the time, a mirage is what you see is really what you see, but it's how you interpret what you see. And you may not be thin at all. You may be very fit still, or it's just very distorted.
Yeah.
I have a thing I do with some of my patients who come in, they complain about their body. And I'll say, what's wrong with it? And he says, well, I've gotten huge, or it's usually very extreme terms that are used. I've gotten huge. Not, I think I may have gained some weight. I've gotten huge. And I'll say, where are you big? And they'll say, my thighs. I say, your thighs. So you think your thighs are big. So what I do is I have them sit there and I'd say, just look at me, but I want you to raise your arms up like this. And then I want you to not look down, but just look at me and move your hands in and out to where you think the width of your thigh is. And they'll stop somewhere. And I'll go up to them and I'll match the width that they're showing. I have them stand up and I move down right to their thigh. Invariably, they are 50% greater than what they actually are. What they see is that. And then I'll tell them, so what you're seeing here is it's hard for you to compute, but what you see is 50% more than what's actually there.
Wow.
And that blows them away. And that's kind of how you start chipping away at some of this. And you have to remind them, I get what you see is what you see. And I don't want to deny that. You're seeing this. The thing you've got to understand what's based on is a brain that's dysfunctioning right now. And your perceptions change. And this is why the worse they get, the more restricting they get, the more they want to restrict more. It is a spiral down, and they have to be very careful about this. And of course, I think they should be getting advice from professionals who really know what they're doing about this. So that's one way to.
Yeah, what are some of those kind of signs and symptoms so that I mean, body dysphoria, a little bit what you're talking about, like how does someone know when they should reach out for help or when something's not quite right?
Yeah. How would somebody know when they're in trouble?
When, and all of us have this kind of thing about how we feel about ourselves and all that. When it starts going one way or the other too much, it's probably time to get some other perspectives on it. And trusted people. That can be a coach, it can be a trainer, it can be a fellow athlete, it can be a clinician, a dietitian, a therapist, a physician, other people hopefully who know about this and can be supportive. And unfortunately, there are not many people like that in the professional organizations. You really have to look.
Yeah.
So
what are the things that can really tip the scale, right? So like, what would people notice in their day-to-day life, their habits that are changing that are red flags?
Well, one of them I want to say that comes from the outside is the first thing people tell me is the comments they get from others. People will tell them, oh, you look like you're losing weight. And that is such a fuel for this.
Yeah.
It doesn't say, again, anything about the weight or why you lost the weight. Well, I haven't had something to eat in 2 days, so that must be great. Look what it's doing for me. Those kinds of things. Where you're getting your decision making, is that coming from a healthy internal place, or are you getting it from all external sources, or are you getting it from trusted people who aren't going to get in the trap about talking about subjective things with you, like how you look, but more, what are you feeling about all this? If you're not processing your feelings, you're going to have trouble. Other things that occur, you start focusing more and more on your appearance, more and more on what you ate, more and more on how exercise is either not there or it's insufficient and you got to do more and more about it. And the worse and worse you are getting physically. Those are all signs that people are going to be desperate and looking for something else.
Okay. Yeah. What tips do you have? So let's say someone acknowledges like something's not right. I need to reach out for help. what advice do you have of who do they reach out to, things to kind of look for, I guess?
It's sometimes really hard to find people who are really helpful. So that's important. Athletes, I mean, a good athlete is always searching for things to help them with what they're doing.
Mhm.
Swimmer, am I really doing what's the best exercise for increasing my pull or form in the water, my diving, whatever it is. They're always looking for that. And so the more they can find somebody who really specializes in this, the better, I think.
Mhm.
And to be honest, this is where people who are trained in eating disorders comes from. Generally, they're very hard to find as far as physicians go. They are out there or they're available either online or you may have to go see them. Another one is that you can look for professionals who deal with this, and the Academy for Eating Disorders, which is an international professional organization, aedweb.org. The International Association of Eating Disorder Professionals, IAEDP.com, I believe. It may be .org. I think it's .com. You can also go online, and there are many chapters around. Now, this is in the US. Now, I want to be clear because there'll be people from other countries. There are organizations like NEDA, National Eating Disorder Association, but other countries in different parts of the world will have organizations like that. And so that would be something to look at and see if they have informational things and contacts of people.
Yeah.
IADEP, the IAEDP, IADEP has certification also for dietitians and therapists and physicians, PAs and nurses. So those are things to look for if you want good professional. If you're in a college, most of them have had this encounter with athletes where they're out of range of being safe or headed that way, and they have contacts for that.
Yeah.
But unfortunately, the way it is, there's just not that many people trained, so you have to go looking. It's not like you can go into the search easy and say, now, if you want breast cancer research, you can, I mean, there's billions of places you can go. But for eating disorders, it's relatively limited. Now, that also goes to people who don't necessarily have an eating disorder, but they are worried or concerned about their eating. And I think a dietitian who specializes in this, has lots of experience training, and at least an interest, who's willing to learn or whatever, those be a very good initial source. Same thing for therapists to help people go through that. Sports psychologists and so on should know a lot about this. How much is known is not always that clear.
Yeah. Yeah.
So if one finds themselves assessing their body and their intake and things aren't getting better emotionally or physically, I would use that as a key to when
Yeah.
to start hunting for somebody.
Yeah, that's great. Finding someone who works specifically with eating disorders, whether it's a diet, like, because I think especially people who are starting to get that awareness, it's like just start somewhere, find a person and open up, and then they can help maybe direct you to the right resources.
And
So
what do you think is the first concern that people voice when you recommend something like this? Can you guess what the first question or concern that people have? Are they going to make me
Eat.
fat?
mhm.
Going to make me fat? That's, I mean, I hear that. I've heard that so many times.
Yeah.
How do you know you're not going to make me fat? And because a lot of athletes are very learned about their sport, if nothing else, very invested, they also like to be educated. So the more you involve somebody who knows their stuff and can give them information that counters suspicion, counters lousy information out there or quick cures or whatever. The ones who can really answer to where the left brain of the person with an eating disorder now can at least argue with the right brain. So you got the devil and angel on the shoulder where you can get that conversation going. So I think that's important.
Yeah, because I was gonna ask, like, what are some, if an athlete or a coach or parent, whoever is reaching out, questions to ask that dietitian or the therapist or whatever, and so something like that, or bringing that concern of like, it's really important for me to understand, like, I need the background. Is that something that you can provide? Might be a good
That's
question.
that's exactly right. Yeah. Another thing is they have to trust the people, and the people they go to, the clinicians they go to, have to earn that trust. It's not automatically granted. I mean, you may go and have, as an athlete, you're going to be skeptical at a time like this. Does this person really know what he or she is doing?
Yeah.
And you got to have some evidence that this person knows it. And that person needs to show that, which, by the way, involves that person taking the time to do so. And showing, reflecting back to the person sitting across from them, the athlete who's sitting there, that I hear your distress about this. And I know you are really troubled and you want an answer. And here's what I can provide for you. And we'll have it. Another thing is it's going to take time. If it's a real injury that's been lasting, it's going to take time. If it's affected them to the point where they really need this, they're probably already in a state where they need some support.
Yeah.
And really need to be able to trust that person. And that's got to be earned by that professional.
Yeah. So when you talked about, the F words and that it's more about feelings. So when someone does go to get help, if you have a client who's going to approach you, like what can they expect? Because if their concern is like, I don't want it to be about all about the food, which we know that it's not. The eating disorder is about the feelings, it's about the trauma, it's all about that. So what could someone expect if they go to set up a meeting with someone like you?
One, they ought to find out pretty quick, either from their website or something along those lines, their history, or from whoever referred them to that person. How do you know this is a good person? Does this person study it? Does he or she, is he or she a member of any eating disorder professional organizations? Does the person teach on this subject? Is this a major focus of what that person does? Those things tell you a lot of experience. Another one is to save your judgment for them until you meet with them. And then sometimes it takes a little bit of time to see that this person's really there for you, and ask difficult questions. How do I know I can trust you? That's one. Just ask it. And I like it when somebody does that. And I tell my patients, you can ask me any question about anything, and if I know it, I'm obligated to tell you what the legitimate answer is. If I don't know it, I'm obligated to tell you I don't know. But I know people I can ask, a lot of people, or I know how to do the research. And just because of what I do and where I am, I know so many people literally in the world who do this. And the Academy, for example, and IADEP both have listservs where you can get on there as a clinician and say, what do I do about this? And you get comments from whomever all over.
Yeah. But what I love about that is I could see even just someone, reaching out to a therapist or whatever it might be, it can be really, the unknown can be really scary. What I like about what you said is that it's giving the athlete the power. And if they have a couple questions or like, here's my goals, here's what I want to get out of this, or whatever it is, it's like giving them the ownership back, right?
Yeah.
So that they come into this meeting, they're like, hey, I have concerns about this. Here's what I'm worried about, or whatever. I don't know, whatever it might be. So I could see the athlete having that power, having some of that control to have a few of those questions top of mind might help them feel more comfortable going in to talk to someone in the first place.
When people go seek help, one of the things they don't realize is physiologically has something happened to them that they don't realize. And that can be loss of estrogen, just testosterone in males and so on. But it can be other things, like now I get low glucose when I didn't before. Why is that? And there are reasons why that happens in this. And why is it so hard to not have it happen? But a lot of times they don't realize it's happening, and most of the doctors don't even check appropriately for it. So, but there are things that they can learn that will do some reality testing for them when somebody is in a situation they're not sure. One of the best things is to challenge their left brain and say, okay, here is your EKG. Here is your pulse and your blood pressure. Here is your creatinine, your kidney function, or here is your glucose and those kinds of things. And they look at their bone density or whatever. And that can be an important reality test that sometimes tips them to the way of getting treatment. I think it's also important to find out more about the person. What else is in their life? What else do they like? What interests them outside of sports or athletics or training? Do they have other areas of interest? And this is where I challenge people. Where is the creative side of your life? Do you do anything creative? Here is what I see of people who get eating disorders, and this is almost universal. Number one, they're hardworking. Well, if they're an athlete, we know that right there. If somebody has an eating disorder, we know that right there because nobody else would go through that effort. They would finally say, give me the cheeseburger and the fries and milkshake. I don't care anymore. I am just going to get rid of this thing. Go for it. But no, not some of the others. They're determined. Number two, they are empathic to a high degree. And I say something like, you quite often use this, you can be on stage in an auditorium and look up and that eighth row, third person from the left is not having a good day. You'd be surprised. I've hardly ever had anybody deny that, any of this. Another one is that they are intuitive, that they can really sense things that others can't, at least at that early. Like the professor walks in, you go, oh my gosh, he's in a bad mood. How do you know that? Well, did you see how he took the pen out of his pocket? And they go, what? And then it turns out, of course, the person's correct. and they're gifted and talented in at least one of the following, but usually the combination. Number one, athletics. Two, academics. And three, creative expression. And because of that, I also get them to tell me about their creative side. And if they're not being creative, there's a hole in their life they're walking around and missing. And that would, during this time, could be something that could be very fulfilling to them, that they could get lots of nonverbal reinforcement of who they are, of what they can do, and expressing themselves. And it can be very rewarding for them to do that. And I tell people that eating disorders, because you get all these things, are the curse of the blessed. You would think the people with all this would not be the ones who could get it, but they're actually the ones who have a target on their chest and are more likely to get it. So if you have all these things, you might be thinking, oh, maybe I'm kind of in that little target on my chest, and maybe that could be part of this. Maybe, but you deserve to see somebody who really knows their stuff to decide what is and what isn't.
Yeah. Well, and again, what's cool about that, and we talk about this, is your injury can become your superpower. And those risk factors can then become the very thing that gets you out of it. The athletes are hardworking, they are creative, they're willing to get their way out, and to have that perspective shift. And hopefully, I hope these athletes who are listening to this right now, where maybe they're feeling a little downhearted at first, and they're like, oh, I am hardworking, oh, I am intuitive. Those can be your superpowers that get you back on the track that you want to be.
Yeah, I call it refocusing your focus, right?
Yeah.
Your focus from here and putting it over here.
Yeah.
Yeah, they're gifted. They have already been doing all of that with their athletics. They're thinking new ways. How can I be sure to do this? What's a new way to challenge this part of me in my sport or whatever? They're researchers and so on. They're not just coach, what do I do, coach?
Yeah.
And they're not like that at all. They want to do more.
Yeah.
So I hope they take, anybody hearing this, I hope they take this as a compliment, because there are lots and lots of outstanding athletes, world-renowned athletes who have gone through stuff like this, injuries, eating disorders, and other things in their life that have knocked them flat. So
Yeah.
I think that's a really important thing for them to do, is refocus their focus, and it becomes their superpower. It really,
Yeah.
they will learn that when they get back to their sport. I tell people who have eating disorders, who have had to go in activity jail, who have
What's
who've
that? I don't know. What's that?
that before. I don't know. Somebody said that once and it clicked.
That's
Where
good.
they can't do what they want to, and then they come out of it going, wow, they use all that other stuff for other things. And then they get back to their sport and they are quickly better than they ever were before.
Mhm.
And that's hard to imagine after you've had, say, knee surgery or a stress fracture or something like that, or some other thing. Let's say you got some illness like Crohn's disease or whatever that you had to go through a time of rehabilitation. And to know that, okay, when I get things back, I use this stuff and then I can actually take off from here and not just be staying low grade the whole time, but I can boom, take off.
Yeah, we talk about life having pillars. Ashley mentioned this, like physical, emotional, mental, spiritual, social. And the athletes have this overly developed physical pillar, right? And your life can't exist in a level fashion if you've got one overbuilt pillar. And so the injury and then the eating disorder, if that happens to be someone's situation, it allows them to rebuild all of those other pillars so that when their life is back, functioning as it should be, it's all the pillars are even. They're not like this, they're not like this, they're not, you know what I mean?
Yeah, they're balanced,
Yeah.
Yeah.
but in a more supreme way. They have a lot
Yeah.
more stability and resilience. So much of this is going to be resilience training that you go through.
Exactly.
And people should understand that sometimes the best thing that comes out of an injury is the repair.
Mhm.
Yeah.
For example, you fracture your tibia, the one place in the future you're not going to break your tibia is where you broke it before.
Exactly.
Extra strong. So
Yeah.
if you can apply that to the rest of yourself, going through that, now you've healed and annealed yourself to where now you're more resilient, less likely to have things happen.
Yeah.
More likely if something's starting to happen to do something about it.
Mhm.
Yeah.
And so much of it is the framing. It is that interpretation. Like literally your tibia is stronger in that moment. Literally you might be stronger and we got to acknowledge it because then you'll really take off, right? It might be stronger, but if we don't acknowledge it, then maybe it feels weaker, physically or emotionally. But when you really take it on, and hopefully as people are hearing this from all these different perspectives, it really can be that the framing, the interpretation is so important moving forward.
And you take somebody who's kind of who's had the wind kicked out of them from their injury like that. And then when they hear from somebody like you two that, or whoever listens to this, who can teach somebody, and they start to feel like, wow, I'm starting to feel better in the ways I've never felt better before. And then what can happen? And they go back to their sport more educated, more alert to things, more directed, and focused on doing things that will make them less likely to be injured and more likely to continue in their sport at even a higher level.
Yeah.
Yeah.
And it's all, if I may,
Yeah, of course.
I want people to remember, we're not just talking about people who are like on teams or whatever.
Right.
People who consider themselves athletic, or they were athletes at one time, but hey, they're 40 now, or they're 50 or whatever, and they're swimming masters, or they're doing pickleball, and they're thinking, I'm pretty good. I think I can beat in this, and they move on. That becomes really important for them because as you age, injury and stuff is more likely. Other things are happening. You're busy, you have a job, you have other things, you have a family. It gets harder and harder to do stuff. I swam masters some, and I can remember going to a masters nationals, and I saw my old swimming coach from high school and from earlier, from elementary school, he was. And I was talking to him. As I'm talking to him, all these other swimmers come up who had all been collegiate swimmers. And you know what? Many of them were hitting times better than they ever swam in college. And they are working out fewer hours by far. And they got smarter about their workouts because they had to be. They couldn't just do 1,000 pull, 1,000 kick, 1,000 swim, and then start your workout. I mean, like, I can remember some of those work, like, oh my gosh, how much of those strokes were worthless, that you were doing just mindless. But they got very efficient and learned. And when you use that perspective, that growth that you have, and the understanding that, okay, I have these certain kinds of limitations, but they don't have to be limitations. And I can learn from this and be a lot better.
So good. So good.
Yeah.
What advice would you have to a parent or a coach who is concerned, or a clinician? Yeah. Someone who's concerned about an athlete. What advice would you have for them?
I want to talk about coaches first. One of the things coaches have to be careful of is thinking more about the team or the coach himself or herself than about the individual. And I've seen it so often that scholarship athletes and so on can really be misdirected on what needs to be done, because schools or the coaches might be thinking about this scholarship athlete. If this person is told right now what you need to do is this instead of working out, that means the team may not do well, and there becomes this conflict of interest. Who is the coach or the parent even sometimes on this? They want their daughter or son to do this. They have to be looking at what is best for that individual. And that's really hard for colleges especially. And I think professional teams too.
Yeah.
Now, people who have it, now if somebody had a torn ACL, yeah, they'd be saying, okay, we want to get you the best care you can, fastest care, so that you can be back, from a selfish point of view, but also a personal point of view, hopefully, that they want the person to recover quickly. Not always should the athlete come back to a sport. It may not be best for them for a variety of reasons. Maybe medically, it is not something that's good for them. And yet, there can be something else they do. You can transform into something else. You might even go from, say, swimming to cycling, or who knows, tennis to racquetball to tennis. Who knows, ping pong. Man, I've been watching some of those on Instagram. Those people are athletes.
Mm-hmm.
And I'm going, wow, okay, martial arts, whatever. There's all kinds of things to look at. So I think having again, this is where somebody who's invested in the individual athlete for what's best for them. Sometimes that's an outside source, outside of the team or the sport. But for coaches, and I think for parents, it's also same thing. What's the most important thing for your son or daughter? What is the most important? And then go from there in this hierarchy. That's the top. Now, what else is important? But make sure that you want them to survive. I had athletes who the pressure was so high on them, they were near death when they were competing, and people, including coaches, some rarely, but sometimes parents and others. But this contest, this meet, the whatever is coming up. It's in 2 weeks. And I'm sitting there saying, I'm telling you, if I had my choice, this person should be in the hospital. But you're saying this event is more. it can be hard for people to maintain the perspective on what's really the most important thing.
Hmm.
And that takes some thinking, and you hope that coaches, parents, teammates, and others are thinking about, okay, what's best for that individual.
What advice would you have for friends and teammates? Because they're often in the mix with these athletes because they're friends, their chosen family, whatever. They don't have the same distance that maybe a parent or a coach would have. So there's an athlete that sees their fellow athlete struggling, maybe losing weight, maybe obsessing about food, not eating as much, eating more, whatever. What advice would you have for them?
Like,
I
how
would
do they
say to them,
Yeah, how do they bring it up?
so I would say be honest with them and say, I'm concerned about you, not about your food, not about all that. Because then you're getting your eye off what's really going on.
Mhm.
The food is where the action is, but that's not what's driving it. And they may say, well, no, I'm eating breakfast. I'm doing all this stuff. And I'd say, don't get in an argument about fat food, figure of fitness. Just say, I'm concerned. You don't seem happy. You seem overwhelmed. You seem obsessed by this. You seem like nothing's giving you pleasure anymore. I'm worried about you. How do you feel about all this? And when I've never had somebody who had somebody come up to them and say, I'm worried about you, ever think bad of that person in the long run, especially. In fact, many of them say the only person who ever brought it up was this person. And they have this immediate alliance with that person that nobody else may have done. The coach may not have, the trainer may not have. It may have been a teammate who herself or himself may have had to sacrifice because this person couldn't be on the relay, let's say, or on the team, or on the in gymnastics, they couldn't do the floor routine. And so the team might have suffered and so on. But they will never forget the value of a person who really puts the injured person interest in what's best for them as the focus. That you don't deal with the details of it at all. You say, I'm thinking about you. When it all comes down, all I want is for you to be happy and you to be healthy. And that's what I'm concerned about. I can't get you to eat. That's not what I'm going to do. I can't do anything else. I can help you get help by giving you some ideas on how to. I could drive you to places, but you're the one who's got to do the work with the people who you need to work with.
Yeah, is there ever, because yeah, like you said, it's all about the feelings. And so getting away from the fat figure, all those things, to just be like, I'm concerned about you. And let's say that person is like, yeah, I'm really struggling right now. Is there any way, and like, so let's say I notice Heidi has lost some weight or she's restricting her eating. I'm asking, hey, how's it going? And she's opened up, yeah, I'm really struggling right now. And we kind of get to that point in the conversation of like, do we need to reach out for help? Right.
Mm-hmm.
Is it, I don't know, is there ever a point where it's like, is it just that, like, hey, let's figure something out together? Like, how do you, I don't know, approach the like, should we talk to a dietitian? Should it be someone with eating disorder? Is it just let's find a therapist and we start there and let them kind of I guess talk about the maybe eating bit? Or does that make sense, that question?
Absolutely. Like anything else, you'd be looking for those people, the professionals who know more about this than others, and whose job it is and interest it is to help people in that trouble, whatever it is. So you can say, I'll be glad to help you find some resources. If you're too anxious about it, can we do it together?
Mm-hmm.
And I'll be glad to be there while you're doing the search online or the phone calls. Or I know some people, but you want me to get some names and stuff, and then you check them out or whatever. I think ultimately the friend has to be the friend, and quite often friends are the ones who can tell you what nobody else will.
Yeah.
And that is, okay, you're in trouble. Now I'm worried about you, and I'll help you whatever way I can. I cannot treat you, but I can support you getting the help you can from those who do know how to treat you. And I'll
Yeah.
support you with that, and I'll admire you for it.
Yeah. Yeah. So is it, if we start with the feelings bit, hey, I notice you're struggling. They're like, I am struggling. As a friend, is it ever appropriate to comment on like, hey, I know you've been restricting your eating a lot, or you know what I mean? Like, should you ever bring that up, or do you wait for the other person to kind of disclose
I-
how things are
Well,
manifesting?
they may ask, how do you see? What do you see?
Right.
And I would put it in general terms, such as you seem to be focused a lot on eating or not eating. And not how much you ate at breakfast. No, well, that was a special day. No, that was when because this. I had an early morning workout. I woke up late. Lots of reasons why. But if you talk about just in general, it seems like you're spending a lot of time, effort on this. You talk about it a lot, and it's obviously important to you. But I see you not joyfully or even neutrally, you're negatively, you're obsessed by it, or I don't know, I'd say obsessed. You seem to be focused on this a lot. And that concerns me. I also see you not being yourself lately. You seem to be more down, and that worries me. I want you to be happy. I want you to be feeling good about yourself because I think you're great. And you don't see what I see, and that tells me something. This is about when you're one kind of athlete and you morph into another as a result of finding out an injury and what it does. So I had a patient who competed in the Ironman in Hawaii, the full thing, and she was a cyclist. She was an animal on the bike, and she would tell me how long it took her to ride this far, and all that. And she always had been and had been working out like that so much. And there came a time when she came in to see me. I said, unfortunately, you need to stop cycling. And it was that deer in the headlights, what am I going to do kind of thing. But due to the medical stuff, she had enough intact to go, okay, I better not do it. And she did. And she followed the stuff, and that's going to be so hard, so hard. I said, I know it is, get support, I'll help you all I can. And she kept a log of how she had for 2 decades weighed herself, like that before what happened after she trained, and then when she got ready to train for another event like that. And it was this graph going like this for years like that. I said, the problem is you're doing this, not staying where you need to be, what. And so we talked about what's behind it and so on. And she really took it to heart. And she did not cycle. And then she was like, one day, I'm not sure cycling's best for me. That, you know what? I don't think I'm missing it that much anymore. And then it was, I'm not missing it. But then it was, oh my gosh, what am I going to do? I said, why is that the only thing you can do? Now, I'll just tell you this, that her husband started taking jujitsu. She decided to take jujitsu. And like within a year and a half, she is at nationals competing.
It's amazing.
And guess what? All signs and symptoms of her eating disorder disappeared.
Wow.
And she didn't weigh herself, didn't care anymore. When she kept fighting, in an appropriate weight, till she doesn't do any of the usual things people do. It's whatever weight I am, and all that. But
So
it did very well, I'll tell you that.
Yeah.
Yeah.
And to see that transformation and realizing I want to do something that fit her better, actually. So
yeah, this injury and then recovery from an eating disorder can create the space for us to then consider other things, right? So as we've talked about, you go from here to here, right? So then you have a space to say, what do I want to do? What is it that I like? What, when you step away from the grindstone.
Gee, my nose feels better already.
Yeah, exactly.
That's good. Yeah, that's good.
Gee, that's the on top. Yeah, skin. Oh, okay.
What would you say if you had your kind of like last piece of advice? You're talking, an athlete is listening to this. Like, what would you want to say to an athlete? An athlete is listening to this, I don't know, in general, like, what's your take home? Sum this up, tie it in a nice little bow.
Messages of hope.
Messages about, yeah, like, what would you want to say to these
Sure.
athletes?
I think if you take your own pulse and you see, or your friends, people you trust around you are concerned, then you should probably be concerned. And then seek the best help you can get from people whom you can trust, and talk to others who've been there, or get the support of others who've been there that you know can understand it, or the people who just know you and want to help you, whatever the reason. And there's help out there. And you are not the first, and you're not going to be the last. And lots of athletes go through this, that, if not most of them, at some point in their career. I'm all in favor of what you're doing, both of you.